Presiding Officer, having your baby in neonatal intensive care is a terrifying experience for any parent. But families whose babies are being cared for by the doctors and nurses at Wishaw Neonatal know that their child is being treated close to home in one of the best neonatal departments in the country. This unit treats many of the sickest babies every year. It's allowed new parents in Lanarkshire to stay close to their families and support network during some of the most difficult and emotional times of their lives. Wishaw Neonatal has won awards for the standard of care it delivers, and even people in this chamber have relied on the unit in their time of need. So why does the SNP want to downgrade this life-saving unit?
First Minister.
Presiding Officer, the recommendations that the Government has considered in relation to the neonatal unit at Wishaw General Hospital were the product of advice from an expert group that included the Medical Director of NHS Forth Valley, Scottish Neonatal Nurses Group, Bliss, the UK's leading charity for babies born premature or sick, and the Scottish Perinatal Network. Now, this group recommended that we should take forward a model which was tested in a number of different sites around the country: the Queen Elizabeth University Hospital, Crosshouse, Edinburgh Royal Infirmary and Victoria Hospital, which proposed that there should be units located at the Royal Hospital for Children Glasgow, Aberdeen Maternity Hospital and Edinburgh Royal Infirmary's Simon Centre for Reproductive Health. Now, those recommendations were made to affect the babies that are at the most serious, who have the most serious and complex conditions or are at the extremes of prematurity, who need the most specialist level of care to have the best chance of survival. Now, that is professional advice, expert clinical advice that the Government has received, and I think the Government is correct to follow the clinical advice that we have received. I would indicate that the vast majority of babies will still be cared for in their local neonatal unit, and these units, including Wishaw, will continue to deliver a range of care, including some intensive care.
Anas Sarwar.
My understanding is that experts actually suggested a range, and the Government is choosing the lower level of that range rather than other options, because the reality is that we know that downgrading Wishaw Neonatal will force families to travel long journeys for care. Take the example of Tammy Johnson. Her son Kai was so sick when he was born that she wasn't allowed to touch him for 72 hours. She gave birth to him locally in Wishaw. But under the SNP's plans, she would be forced to travel perhaps to Aberdeen or even further afield. She told me Kai was so ill that he was 4 weeks old before I was allowed to pick him up. How would he have been put in an ambulance anywhere, let alone to Aberdeen? Doing things like that can cause everlasting damage. The SNP's plans to downgrade the Wishaw neonatal unit are opposed by clinicians, experts and parents like Tammy. So why does John Swinney think that he is right, but the experts, the clinicians, the nurses and the parents are wrong?
First Minister.
There are 2 points that I will take issue with Mr Sarwar about in his description of what he's put to Parliament today. The first is that this is somehow my personal individual view. This has been a view where the Government has sought expert clinical opinion. This has not been conjured up by the Government considering an issue on its own behalf. We have sought expert clinical opinion, which I have put on the record as to where that's come from. And there will be other occasions in Parliament where members of Parliament will take the Government to task for not following expert opinion, and here Mr Sarwar wants me to ignore expert clinical opinion, which has led us to the conclusions that we have led to. And the second point that I would make is in relation to the future of the Wishaw unit. The unit at Wishaw will still continue, but for a very small number of babies where there is a need for expert specialist care to maximise their chances of survival, will have recommended to be treated in a different way. And that's the expert advice that the Government has received.
Anas Sarwar.
I think John Swinney is choosing to listen to certain experts and ignore other experts in the process and hide behind experts when it comes to this government's decision. The reality is that this is an award-winning unit that is giving life-saving care, and the expertise exists there, but would not if this unit was downgraded. And the SNP's failure to support neonatal and NHS services has a human cost. I'll give them another case, the case of Amanda Todd, a mum who faced the prospect of travelling from Scotland to Dublin to give birth. Why? Because the SNP has already overseen a shortage of beds here. Amanda only found out that there would be space in Scotland for her and her baby the day before her operation. She had to be told to plan to go to Dublin. Amanda told me it seems that the SNP government cares more about saving money than saving babies' lives. But Amanda's story is just one example of how the SNP has broken our NHS. Just this week we learnt CAM's waiting list growing, Scotland's NHS facing a cancer specialist crisis, and more Scots than ever before being forced to go private. So isn't it the case that the NHS simply isn't safe in John Swinney's hands?
Yep. First Minister.
The first thing I want to say is that there is nothing in the proposal about Wishaw General Hospital that is about saving money. It's about maximising the chances of saving babies' lives. That's what the proposal is about, informed by expert opinion. Now, on the question of cancer care that Mr Sarwar raised, what I would indicate to him is that in relation to the 31-day standard, the performance at the last stage of reporting was 94.7% of patients were treated within 31 days of a decision to treat. And the median wait for treatment was 4 days. 4 days. So at least half of patients are being given treatment within 4 days of being referred for the 31-day standard. Now, I appreciate there are pressures on cancer services and on healthcare services across the country. That's why the Government has brought forward measures which are strengthening the National Health Service, which are, for example, we committed to an additional 64,000 appointments and procedures by March of this year, and we didn't deliver 64,000, we delivered 105,500. Now, that is the Scottish Government putting in the investment to strengthen delivery so that we reduce waiting times and improve access to the National Health Service, and that will dominate the Government's approach to the National Health Service in the period to come.